Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, a clinical microbiologist and the chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic and the president of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in laboratory testing during the COVID-19 pandemic. So, Bill, welcome back for our weekly talk.
Hi, Bobbi. It's good to be back.
Yeah, I figured this is Bill and Bobbi's banter, or Bobbi and Bill.
Wow.
What do you think?
Bobbi and Bill, you're the headliner. So yeah, Bobbi and Bill's banter is great.
Well, thank you. So, we've talked a lot about COVID, of course, and masks, and I've had some follow-up questions about some myths that people have been propagating about mask wearing. So I thought this would be a good session to just debunk some of those common myths. So if you're up for it, I've compiled a list of myths that people have said about mask wearing.
Yeah. Well, I mean, first of all, I think it's great. I think we should. I am up for it because we know now that the real struggles with containing the spread of COVID probably are in small gatherings and community spread, where masks can be really helpful, probably are most helpful. And the others, of course, I'm wearing a Santa tie. So I'm already kind of in the myth mode. Hopefully that there's not anyone anyway. So yeah, hopefully I didn't ruin anyone's Santa Christmas story, but yeah.
Well, I've already seen some masks coming out with holiday themes. I saw one with a Rudolph reindeer, big red nose. So
Nice.
I'm sure that we're going to see lots of Christmas and other holiday themes coming up soon. With our masks. So let's talk about masks then. They're going to be around for a while, even though we're starting to see the vaccine roll out. So I think even though we've talked a lot about it, it's good to just go through some of these myths that people still have. And I think one of the first ones is people thinking, people saying, I feel fine. I don't need a mask. Why do I have to wear a mask? I feel completely fine. What's wrong with that?
Well, first of all, before we delve in, I think it's the reason why I think it's now we're all getting sick of wearing masks. I mean, they're not. It's great that they make them fun and festive, but they're just not. I mean, they're not very easy at times when you're trying to communicate. You have to remember to put them on. Your glasses fog up, and so I think it makes some of these myths more appealing. And the first one is that one. I feel fine. I don't need a mask. Well, again, the two things I would say, the reason why you need to wear one when you feel fine is that when we're really trying to do, and when the masks are most effective, is preventing one person who has a virus from spreading it to someone else. And there's lots of good science behind that. This isn't just conjecture. But the other thing we know is that people are most prone to spread the infection right before they get symptoms, when they don't know they have it. And so that's why you need to wear a mask, is because you might have COVID and not even know it. So you're protecting other people that way. The flip side is it does provide some protection for you. If it's an N95 mask or one of the high filtration masks, it is very protective. But even a cloth mask does help somewhat. And so those are the reasons why, if you feel fine, you should really be wearing a mask. The third part, honestly, it's just out of in the spirit of the season, just thinking of others. People are very anxious. People that go out that have underlying health conditions that are really concerned about getting. People that go out that are really concerned about getting sick from COVID because they know they have underlying health conditions. It can be quite anxiety provoking for them to see people not wearing masks, and so it just improves our overall societal sense of security, which allows us all kind of go about our daily lives as much as possible.
Yeah, I agree with all those points. I mean, we're in this together and we should be doing this for ourselves and for others. And so, like you said, it's really multi-part. First of all, understanding that you're wearing the mask for yourself, but also importantly to protect others around you. And also, even if you feel fine, you could be infected. And as you mentioned, we are sometimes, in many cases, highly infectious a day before we even start having symptoms. So important points. Wear a mask. You may be sick and not know it, and you're protecting those around you and yourself.
That's right.
So, what about then if you are physically distancing? Say you're in a room, but you're 6 feet apart. Another myth that I've heard is that I don't need to wear a mask as long as I stay 6 feet apart from everyone.
Well, again, the 6 feet apart social distancing and masks is a little bit of belts and suspenders, being doubly safe. But also, we do know that the virus, the 6 feet comes from droplets, knowing that the droplets that we create when we're talking or sneezing or singing or any of those things can spread the virus. And those do travel about 6 feet. But there are smaller, not droplets, but smaller particles, if you will, but, aerosols that can travel further. And that's not probably the primary means of the spread of COVID, but COVID can spread through that means, especially indoors with high ventilation. When in this part of the world, we're going to be indoors and with heat on. So social distancing is not enough, because although it does help, it doesn't completely prevent the spread. And we know that having a mask on top of social distancing is what makes it really safe.
Yeah, great points. Now, a question that someone raised to me: what if I'm out walking in the middle of a field, hiking by myself? Do I need to wear a mask?
I think you need to just use good judgment.
Yeah.
If you really are out on your own, and I talk about that because I'm an avid cyclist and runner, and there's times that I don't wear a mask because I literally see no one out, because we're lucky to live in a relatively low population density. But again, if you're in an area where you think you're going to have a high likelihood of running into someone, I think it's good to have the mask available, to put it on, to wear it, if you're in a city or in an urban area. And again, part of it is because of to protect you, to protect those around you. And it gets back also to that whole idea of safety in the community. I've heard stories of people being injured because they get really anxious when they see someone approaching them without a mask, and they try and, especially the elderly, and they feel like they have to try and move. And so, I think you have to use good judgment and err on the side of wearing one. But if you're really out there totally on your own, you probably don't need a mask.
Good. That's how I answered the question as well. I have noticed if I'm on a sidewalk and I'm not wearing a mask, which I did early on, people would really go out of their way and cross the road even, which could be dangerous if there's a lot of incoming traffic. So now, if I'm in a city and I'm going to run into people, I just always wear a mask. But,
and actually that's what happened. The story is very personal. It was my mom in Chicago. Same thing. People were walking. The sidewalks are narrow there. She got really anxious and she tried to get around them, and she tripped and broke her nose.
Oh, no.
So these are the sorts of things that can happen. So, we have to think about all that stuff.
Yeah. Well, what about the statement that there's no scientific evidence that masks work?
Well, that's an absolute fallacy. There's a lot of scientific information that masks work, and it's both in kind of traditional studies, if you will, as well as with empiric or observational science. So, we have done studies even here at Mayo. And again, part of why we did those are for our own staff, a big part why. But on the one side, look, for healthcare workers that are working long shifts, wearing masks continuously is very fatiguing, particularly if they're in a high-risk area where they have to wear high filtration or the hoods, the Piper hoods. So they need to know it. Plus, our staff want to know they're safe. So we did a study here using as close as we could to replicate people with the virus breathing, using special machines and mannequins. We were able to show that wearing a mask essentially dropped the spread of droplets and aerosols to zero by the mannequin that had theoretically had the virus anyways. And also showed that it did protect the recipient to a lesser degree. So there's good science there. There's others. There was a Duke study showing a very similar thing and looking at different fabrics and how effective they were. So there's a lot of good science showing that masks, even cloth masks, prevent the spread of the droplets and the mists that carry the virus. And then we've seen that in our own practice again. Once we went to universal masking for both patients and providers, our transmission rate and our infection rate, even during the surge in places locally, has been dropped essentially to zero. Most of our documented cases are when people don't have masks on, either carpooling or at a break table where they're sitting close to each other. So yeah, we've seen it in both, and I think the carpooling was an interesting example because that's again why these myths get to be dangerous, because you get in the car with your friends and you don't want to wear a mask, but unfortunately, if one of you has COVID and doesn't know it, now you all got a big problem. So yeah.
Yeah, that's one of the most dangerous situations because you're in an enclosed space and there's not a lot of air circulation too.
Exactly.
Yeah.
And there was the other study too that people cite, which I think is a really compelling one, with the hairdressers.
Yeah.
And I think it was somewhere in the South, but it was much earlier this year where there were two hairdressers. One had COVID, but wore a mask the whole time except for in the break. I know it was a man or woman, but on their break, during that break, they spread it to another hairdresser who also masked always while taking care of their clients. And none of their clients did contact tracing, and there were over 100 exposures, and none had contracted COVID. So I think that's pretty compelling.
It is really compelling. You think of how close a hairdresser gets to you, and they didn't pass it on to any of their clients. I think that, there's lots of good data out there now, and we'll include a link to the Mayo Clinic study in this podcast as well. So what about then the negatives or the perceived negatives of wearing a mask? We know it's not necessarily comfortable, especially if it's one of those more protective, higher filtration N95 masks. But one myth that I've heard brought up quite a bit is that wearing a mask can cause you to inhale too much carbon dioxide and make you sick, or it could even cause pneumonia, or it will hurt your immune system. What do you think about all of these?
Well, there really are no documented negative effects like that of wearing a mask. Another one I heard is dental problems. That people get dental problems from wearing a mask. And honestly, there's a lot of professions, especially in healthcare, where people wear masks the majority of the day. And we've never had to. And look, we are as a healthcare provider, we're interested in the safety of our own employees as well as the patients that we treat. And then we are overseen by OSHA and a lot of different regulatory agencies that look at hospitals and make sure that we're staying safe. JCO, others. There's never been any concern for healthcare workers about negative health effects of wearing a mask. In fact, we're always just judged on are people wearing masks appropriately to protect them from potential respiratory pathogens. And so I don't think there's any evidence to suggest any of those things are actually true. The one thing that, I would add is that one thing that's come up, and maybe you're going to get to it, is one of the myths is, well, what if I have breathing problems? Should I not? Again, that's something you'd have to talk about with your physician. But by and large, even if you have, pretty severe pulmonary disease like COPD, you can still tolerate a mask. Sometimes so you really need to talk to your provider. But most people can wear masks safely, particularly cloth masks.
Mm-hmm. Well, and you could argue that people with respiratory problems are actually at greatest risk or at increased risk of having severe disease. And so those people should definitely be wearing masks.
Exactly. And I just so everyone knows, I did talk to him about this because my dad has COPD and lives in Chicago with my mom. So yeah, we've talked about this a lot because they're in a very urban area of Chicago. And so he wears a mask when he goes out. And so there was one study I tweeted that looked at mask wearing amongst athletes. It was from Asia, and I think it might have been Hong Kong or Singapore. I can't remember exactly where, but they did look at athletes. And one of the things they did that was interesting was they had them do exercise on a treadmill wearing different masks or wearing a mask to see the perceived exertion. And there was an increase in perceived exertion with the mask. It was pretty subtle. So it is harder to do, to really be active with the mask on. You want to be thoughtful and careful. And just like you want people to be careful this time of year in Minnesota when they go out to shovel snow, you are putting out cardiovascular stress. So you just want to take that into account when you're out wearing a mask.
Yeah, all excellent points. Those were the myths I had, Bill. What myths have you been hearing? Any others to add?
No, I think the one was on, dental problems and health problems. Again, no documented evidence of that. In fact, there is now, as we look at the actual long-term complications of COVID, there are some reports of people losing adult teeth. We don't, it's still anecdotal, so we don't have an association, but there's a thought that maybe the vascular injury that comes with COVID could in some people damage their teeth. So you might be more at risk of hurting your teeth from getting COVID than from wearing a mask. That's number one. The other is, somehow I'm going to be now more prone to getting other illnesses because I'm wearing a mask and not getting exposed. Again, I don't think there's any truth to that. Particularly as an adult. I mean, if there's any time of life where being exposed to different environmental pathogens helps you develop immunity, it's very early in life. So it's certainly not for adults, and certainly even for kids. They're not going to be wearing them enough to really meaningfully impact that. And the other is, well, the virus is so small, how in the world could a cloth mask filter out the virus? And again, it's filtering out the droplets which carry the virus. The virus in it by itself can't spread, it can't fly. It can be on a surface, but it needs to be in your expired moisture, whether it's droplets or mist, to get someplace. And that's why the masks help.
Yeah, so lots of good reasons to wear masks, and I share those with everyone who asks me these as well. There's a lot of good data out there now too, which is really helpful. We've learned so much during this pandemic, and I think initially we weren't really sure on the use of masks, but now I think we can feel pretty comfortable in the important role that they play.
Yeah, and there's lots of fun things you can do with masks too. In fact, for instance, if you're a sports fan, you can wear your Wild mask.
Nice.
Or you can be color coordinated with your outfit. Like this, with your mask. So it can be part of your sartorial splendor and bring joy in the season. So there's lots of upsides to the mask.
Yeah, I have to say that I'm guilty that I probably have about 30 or 40 masks now to match my outfits. Yep. And I also have some with ticks on them and parasites and others that I've designed myself. So you can have fun with them too.
Yeah, see, and then you can gauge people's response to parasites by how they view your mask.
And if they really keep their distance, right? If you make them scary enough.
Well, I'd say, and honestly, the biggest, to me, one of the hardest things is fogging up the glasses. And also, I tend to use this headset on calls, and then if I have to go in and put a mask on, it's pretty hard to put a mask on over a headset. So those are the downsides that I've found, but those seem very manageable.
I agree. Well, I think that this was really helpful, Bill, and we can point people to this if they have questions about myths with wearing masks, and also that Mayo study will have some good information for them.
Yeah, I hope so. And most importantly, stay safe. We're going to need to be wearing masks probably through the remainder of 2021 because of the vaccines are going to take a while to roll out. So, but we're sort of at hopefully at the beginning of the end rather than the end of the beginning with this. So it's just a matter of stick-to-itiveness. And so hang in there, people, and wear a mask because it helps keep you safe.
Yep, help keep yourself safe and everyone around you. Well, thanks, Bill. It's great talking to you as always.
Yep, you too, Bobbi.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.